about the cost of healthcare and how to solve it. We'll be right back with you in just one moment after this. All right, good morning and welcome back to the Money Advantage podcast. This is Rachel Marshall, your co-host, along with Bruce Wayner, and we have a special guest with us today. We're talking with Dave Chase of Health Rosetta, and we're talking about that rising healthcare costs and how to have a solution in this particular industry, in this field, in this area of our life that can feel really frustrating. So if you're concerned about ballooning costs, looking at your health insurance, looking at the cost of healthcare itself, looking what that's doing to your bottom line, this is the show that you really want to tune into. We're talking about how to solve healthcare costs with a completely transformative mindset and concept today. So Dave Chase, welcome to the show.
Thanks for having me on. I'm really looking forward to the chat.
Excellent. Well, let's just share a little bit about Dave before we get started. Now, Dave Chase leads the vision for Health Rosetta, and really his goal is to empower community-owned health plans. And so we're going to talk today about that. He has also had a TED Talk, which I had the pleasure of listening to, and you've also written a best-selling book. You've been on Fox, and you are doing a lot of work in the consulting area for healthcare costs. And so I would love to be able to let you share that. I also want to point out what's really interesting. You've done some work that with a company that turned into WebMD, and we're able to sell that as well. So probably our audience would be familiar with that, as we probably have all Googled our symptoms at one point or other, and that all comes back to you. Also, outside of that, you are an oxygen-fueled mountain athlete, which I'm very curious about. And you have done quite a bit of running. I will let you talk about that, but you are a very awesome runner with the 800 meter and fast races. And you are really looking to be a servant leader to 4 million lives. So I love where you are coming from. So Dave, can you tell us a little bit about you and what led you into this healthcare space?
Yeah, I mean, I'd been in healthcare, had a few roles. I started my career in what's now Accenture in hospitals, working inside, often the billing department. And then I went and founded what's today's Microsoft's $3 billion healthcare business, which a lot of people aren't even aware of.
No.
How big their business is on that. And then, as you mentioned, I started a company that ultimately was acquired by WebMD. But the real pivotal moment for me was, unfortunately, by the time I was 40, I'd had 10 friends my age or younger die. And obviously all of those are gut punches, but the last one was particularly rough. It was a friend that she'd had a similar career trajectory to me, done the right things, done quite well. And she ended up getting diagnosed with cancer, actually misdiagnosed with cancer. And to make a long story short, that led to the wrong care plan. And ultimately, she was devastated physically, mentally, financially, and ultimately leaving behind, as a single mom, a 10-year-old daughter. And, that was really rough to see. And particularly when I recognized that it was a complete system failure. And I'd been a part of that system. And the way I was raised was, if you see a problem and you don't do something about it, you're complicit. And so that really put me on this journey to really understand. I mean, I'd seen different dysfunctions in healthcare, and I just really dug in. If you ask why 5 times, you get to the root cause of just about everything. And to make a long story short, the way we purchase healthcare in this country is radically flawed to be charitable, and that leads to a multitude of issues that I'm sure we'll talk about.
Well, I appreciate you sharing that backstory, and I'm getting chills as you talked about just the reason why you came into recognizing this problem. And it sounds like a very personal story for you. And so I can let you know that we have a very personal story for why we do the work that we do as well. And part of that comes back to making sure that we're leaving the best legacy for the people who come after us, because none of us are going to be here forever. I personally had a very close brush with death about 18 months ago. came out of absolutely nowhere, had no idea that it was going to happen. After I gave birth to my daughter, I almost died. And because of that, it's really set us and my family on a trajectory to make sure that our kids have absolutely everything that they need so that we can continue on our legacy of what we want through them, no matter what happens to us. And that also plays into life insurance, which is a huge piece of what we do. But today specifically, we're going to be talking about not only this very close to the vest concept of our health and our livelihood, but how can we make sure that we're getting the best in that area and also not having that be a money leak, which would be something that is additional costs that we're paying for something that we don't need to pay as much as we are, and we can find a way to improve the service, improve the quality of care, improve what we're getting for less cost. And we're not just sacrificing the value, but we're looking at a way to keep more of the money that we make so that we can truly grow wealth. So all of that. Bruce, do you have anything that you want to jump in on?
Well, Dave, I know you probably have a rhythm to educate different listeners. And at the risk of upsetting that rhythm, I'd like to ask you a few things. I've been a business owner for a while now, and healthcare costs are just staggering as a part of it, the insurance part of it. And I've been fascinated at the attempt to improve healthcare costs over the last 5-6 years with the mandate actually caused my own business to average about 23.5% increase in my insurance cost over the last 5 years. And what we're attempting to do here at the Money Advantage is to help business owners think outside the box and creatively to take care of their healthcare costs. And there's a variety of things that we have, resources to help them. And I'm so glad you came on. My problem with all of this, and I don't want to get too political, but it's actually part of the politics, both of the right and the left side, is, what is on everybody's mind right now is the COVID-19 epidemic or pandemic, excuse me. And yet we don't hear anything in the news. We hear about mask mandates. We hear about social distancing. We hear all about that, but we don't hear anything about improving our immune system to take care of the response, through proper exercise and diet. And that seems to be a problem in our entire healthcare system, is that we are not trying to actually make people healthier by lifestyle choices, but we're trying to make them healthier through prescriptions. And that seems to be a big driver in the monetary process of this whole thing. So I was hoping we would cover some of that today in your process.
Yeah, no, and I'm happy to jump all around, so don't worry about that.
Okay.
I look at COVID as sort of a super spreader event of a set of pre-existing conditions that exist inside of our country and our communities. And they really shine a light. And to just touch briefly on Rachel's situation, because we're going to talk a lot about costs, and that's obviously important. But I want to really emphasize that the best healthcare is often the least expensive healthcare. And your experience, of course, I don't know about the specifics, Rachel, but I will tell you that unlike every other developed nation, our maternal mortality rate has gotten worse over the last 20 years.
Yes.
And it's just horrific. And now there's a couple places like California and South Carolina that have been doing some things about it, but it shows you where our priorities are in our healthcare system when we're actually getting worse, where the rest of the world has been getting better over the last 20 years. So just want to mention that we are very focused in on quality. But to Bruce's point, you're right. If you look at the dynamic going on, the people who have the most compromised health going into COVID are the ones who are dying at the highest rates, right? People with so-called comorbidities. And if you look at that, that's a real issue. One of the things, again, we're going to talk a lot about costs, but I would really want to clarify one thing, that there is a huge difference between costs and prices, because costs have been flat in healthcare for at least a decade. talk to any doctor, nurse. The only real exception to that is in some specialty drugs. So nurses and doctors, they're not paid fundamentally different. The inputs into healthcare are not fundamentally different. It's the prices that are different. Because healthcare isn't expensive. Clinicians are only getting 27 cents of every dollar that we're ostensibly spending on healthcare. And so sometimes people are kind of shocked, like when we have many case studies where people are spending 20, 30, even 55% less per capita with superior benefits and no out-of-pocket costs for the employees. And they're like, how do you do that? Well, you get rid of all this garbage. That the part that's expensive about healthcare is profiteering, price gouging, administrative bloat, and outright fraud. And I mean, just fraud alone, the Accenture and FBI estimated this is almost a decade. It was $300 billion. And as I go into my book, there's a reason why the fraud prevention is so pathetic in healthcare versus financial services, because guess whose money is at risk? Our money, not the carriers. And so fraud, oddly enough, is basically good for the business model of carriers. And specifically, as we talk about COVID, just to give you an idea of how upside down our system is, in the midst of this pandemic, like none of us have seen in our lifetimes, there are medical practices, particularly primary care, that are shutting down financially because of what's happened. At the same time, the mega carriers have had the biggest earnings that they've had in, maybe ever. They're doing incredibly well because the volume of healthcare has actually gone down dramatically. Certainly during the shutdowns, it's gone down, but they're master marketers. They're making you think that the costs are going up. They're not. The prices are going up. And again, I get into the details of how they do that, why they do that. I mean, there's good people inside of those organizations, but they're operating inside of a set of perverse incentives that lead to this dynamic. And you mentioned, the last 5 years, really the last 10 years, the increases have gone up even higher because of a clause in the ACA that sort of turbocharged a pre-existing dynamic. And so if you look at the stock prices of the carriers over the last decade, I mean, this is right there with Amazon in terms of returns. So that's kind of how upside down our industry is right now.
That's just so many interesting thoughts right there. We could unpack this for a really long time. So let's go ahead and first kind of break out what is the difference between health insurance costs and health care costs.
Yeah. Most of what we think of as healthcare are predictable, budgetable items, particularly over enough lives. You have 1,000 lives, certainly 10,000 lives. You can have a certain number of primary care visits and surgeries and cancers and all that type of thing. That is basically a budgetable thing. The actual insurance component is only about 15 to 20%, for the rare cancers, the premature babies, these type of things. That's actually the truly insurable events. It's interesting because you ask people sometimes, where do you get your health care? And they say, oh, Blue Cross. It would be like saying, what car do you drive? Geico. It's just like we've confused these two things. And so the actual insurable events are a fairly small portion of that. And again, some of that's gone up because of specialty drugs and some things, but again, that's only on the 15% of the spend or so. So that's where the big difference is. And so as employers, you have that, once you have that insight, like I was talking to a CFO of a manufacturer, about 750 employees, they took their healthcare spending from over $8 million to under $3.5 million. Wow, how did you do that? Well, it goes back to the get rid of all the garbage. And what that meant for that business, I asked him, it's like, you were a slow growth, mature manufacturing, low margin. What would you have had to increase top line sales to have the same EBITDA impact as what you did in healthcare? Because they took, 4.5 to 5 million to the bottom line on a recurring basis. Like, we would have had to increase top line sales revenue 25 to 30%. Like, how hard is that? Hands down, the chapter of my first book, The CEO's Guide to Restoring the American Dream, that resonated the most with business owners and business leaders was one that said, you're in the healthcare business, whether you like it or not. Here's how to make it thrive, because it's often the second or third biggest cost for most businesses, and they aren't managing it like they do every other thing that they procure care for. So we can talk more about that, but that's a few points I'd make.
Oh, that's very, very fascinating. And one point that I just really want to highlight is the idea that in any area of your financial life, making more money is a good goal, and you want to always be providing more value and increasing your top line revenue. But if you can keep more of the money that you're already making, you're light years ahead. You are light years ahead. That is a little more clear way of saying that.
Yeah.
By having more to work with and focusing on something that's even a little bit easier to do and easier to control rather than increasing the top line revenue. It doesn't matter how much you increase the revenue if you're still not keeping any of the money that you make.
Yeah.
So, Bruce, do you have anywhere that you want to go before I jump into the next question?
Well, Dave, I would really like to know your perspective on, the simple ways that businesses could actually tackle these healthcare costs, going forward. And I'm sure they are outlined in your book, but if you can give us some tidbits of how you see that.
Yeah, we have a 5-step plan that it spells out an acrostic local, because a lot of what we talk about is relocalizing health. I mean, what's more local than an interaction between a doctor and a patient? Yet at least half of the dollars are getting hoovered out of local economies to basically Wall Street. And so the first thing is learn how to leave behind status quo mindset. It's just a mindset shift. A lot of people think healthcare solving it's like trying to solve Middle East peace. Like, that's what the status quo protectors would like you to think. It's not true. So that's a lot of why I wrote the book. The O in local is optimized plan infrastructure. This is the boring stuff, but it's like how you pay your broker, how things are disclosed, who processes your claims, all that kind of stuff. We've seen employers get up to $1,000 per employee per year of savings without changing anything else that I'll go into. And a lot of people are concerned about, changing things on their employees. And in this 5-step process, 4 of the 5 steps are either invisible to the employee or only clear positive value add. So the first thing that gets into the care, really low hanging fruit, is the C is carve out PBM. PBM stands for Pharmacy Benefit Managers. Most people don't even know these companies exist. The big 3 that control 80+% of the market are in the Fortune 50. Not to let pharma off the hook, but there's not one pure pharma company in the Fortune 50. Johnson & Johnson is the only company in the Fortune 50, and they've got a bunch of other businesses. And they've managed to create 32 different revenue streams for themselves that people have no idea about. And so there's a lot of low-hanging fruit there. You don't even have to change your formulary where you get your drugs. You can get huge savings there. The A in local is add value-based primary care. There's no well-functioning healthcare system in the world not built on proper primary care. 50% of ER visits, for example, are not emergencies. People just go there because they can't get into proper primary care, because essentially we've destroyed primary care in this country over the last couple decades. And so there's more to say about that, but that's a big one. And then the second L, is leave behind value extracting PPO networks. PPO networks is preferred provider organizations. This is like, you have a fancy logo on your health insurance card that gives you access. It's just become a glorified yellow pages that gives you the privilege of wildly overpaying. Typically, these things get the employers to spend 2, 3, even 10 times Medicare rates, which cover costs for healthcare providers. That's where the biggest savings are. That's actually where you have to be the most careful. That's the first one that the employees will notice. Now, if you do it right, they notice it in a good way. Like with Pacific Steel, that company I mentioned, they provided a concierge that kind of guides them through. And they said, if you go to a high value care provider, we'll waive all cost share. And people don't have to be healthcare experts to understand zero. And it's often the same doctor, just a different setting. So those are the high level steps that get you there. And some people will rip off the Band-Aid, do it all at once. Most will take it step by step, maybe over 2 or 3 years.
So I was excited to talk to you this week because I was just recently approached by somebody that knew about what I did and worked with a lot of business owners. And they said, we think we could help you with your business owners' healthcare costs. And they gave me a couple of high level things. And one of the things that you just mentioned was the Medicare rate, or paying off the Medicare rates. And they actually negotiate this. And I'm like, I didn't know this actually existed,
Yep.
you know.
Well, I didn't either. And I know that there's a contracted rate that is usually paid by the insurance company. Is that different from the Medicare rate?
Wildly different.
Interesting.
Yeah. So Medicare, healthcare providers are required to report their costs, and there's some regional differences, and then there's some built-in margin for them. Despite some hospitals will say they lose money on Medicare, and it's one of those areas where they have funny ways of describing losing money and saving money. So like if your premiums were going to go from say 5 million to 10 million, and they only went up to 8 million, they'd call that 2 million of savings. That's not real savings.
It's the same way the politicians do their budget.
Yeah, and
it's
and
exactly the
so,
same way.
Yeah, and so they don't make as much money, and essentially baked into every business model in healthcare implicitly is that employers will stay asleep at the wheel forever. It's been a really good bet for a long time. But yeah, there's like in the case of Pacific Steel, what they did to have that steep decline, it was about 3/4 of it was reduction in medical spending, about 1/4 on the drug side. And on the medical claim side, they use Medicare as a benchmark. So they would go to a provider, say, Bruce has got to get a, rotator cuff procedure, not an emergency thing. And they'll say, hey, we'd like to go here. We have a very simple agreement. We'll pay 120% of Medicare rates or 160% of Medicare rates. So it'll still be above that. And we'll promptly pay. You don't have to wait months for it. And we're going to waive all cost sharing if Bruce goes here versus another place. And they're like, whoa, sign me up. They did 5,000 direct contracts in 2 years. These are incredibly simple 2-page agreements. Because Medicare is so well established, people understand them. For a lot of the independent surgery centers and doctors, it's actually giving them a pay increase, even though the overall spending went down so much for the employer. And what the best part about this story, though, is this happened to be an employee stock owned company. So, a more profitable company is a bigger nest egg. There was a forklift driver, worked there 30 years, topped out at $45,000 a year. I can't give you the specific thing because I'm sort of sworn to secrecy, but let me just say, well into 7-figure nest egg for a working class individual. That had doubled basically because of the value of the enterprise went up so much with this recurring kind of $5 million, almost $5 million boost in the profits, because that just went right to the bottom line.
Wow. So fascinating. Now, Bruce, was there something else on what you were saying? I didn't want to take away the point you were saying about learning.
I don't know if there's something else, but I am curious of how this new trend towards concierge doctor services works into this. My wife and I are actually considering doing that. And then also, how do you mentioned about pharmacy? How do these companies, like you see on television all the time, Good RX, where the lady goes in and the drug is $69 and she gives them this Good RX and it's like $4. I mean, first of all, how can this actually be a moral situation in this situation? And actually, how does that company, Good RX, make money to be able to provide these services?
Yeah. Well, first of all, on the concierge piece, that actually was started in Seattle. It's kind of interesting where at the same time concierge medicine was started, it was actually the former Seattle Supersonics team doctor who realized, gosh, there's people, because they went to extreme lengths to keep the NBA players healthy. They're like, you know what, there's other people who don't want to miss work and want to stay healthy. They're called high net worth individuals. So that was kind of one path, where it was very expensive, high touch, marble lobbies, terry cloth robes rather than, all that type of thing. But there's basically concierge medicine for the masses, which is called direct primary care. And that's been growing gangbusters over the last 5-10 years. That's what we like to see employers put in. And so it basically, you pay them sort of like a gym membership, just a monthly set fee. So they have no incentive to like get you the high margin stuff, because typically the reason why hospitals acquire primary care is they're, kind of milking the back of the store. You get in there and a typical doc can drive $10 to $14 million of referral value, a primary care doc. And so you really want an independent primary care doc that doesn't have those perverse incentives. And then when you talk about the drug side, we could do a whole episode on all the money games and how the money flows. So GoodRx is sort of a Band-Aid on that, because there's a lot of different contracts out there and different amounts that are paid. Walmart's got their $4, prescriptions. Costco's incredibly affordable. And so, again, that would be a longer story to get into all the 32 different revenue streams that they create. When like Caterpillar, is a large employer, they really applied their supply chain expertise to drug procurement starting about a dozen years ago. Because of that, really, that's the only thing they've done in their health benefits. They haven't seen overall healthcare spending at Caterpillar for their employees go up in over a decade, because that just gives you an idea of all the shenanigans that are going on there. And here's the backdrop. It's an important one I think everybody should take away. And this is what the employers that are having success, this is part of the mindset shift, because they all say employees are our most valuable asset, right? Who hasn't heard a CEO say that? Well, if they're your most important asset and the health plan that you've been giving them has led to 20 years plus of wage stagnation, decline for the working middle class. By the way, that's defined as economic depression. That's why we have a lot of the nuttiness going on in that country. That's something where, and guess what? If there's one thing that we're the undisputed world leaders in, it's the opioid crisis. What paid for that? Employer health plans. Working age people and their dependents overwhelmingly are the ones impacted by the opioid crisis. And we can go into what led to those perverse incentives and all that. Lower back pain is a great example of how badly we botch it. Second most common reason people go to the doctor, number one driver of disability, number one driver of opioid prescriptions. Guess how much evidence there is that opioids are effective for lower back pain? Nada, zero. Yet that's what our system has driven. At best, they'll mask some short-term pain while the underlying issue persists. So it's those type of things that if you say, okay, this is our most important asset, like all other areas in procurement, it is a privilege for you, healthcare industry, to serve our most important asset. We are going to purchase in this way. Would you like to play? It shifts a supply-centric industry to a demand-centric industry. You don't see Boeing saying, hey, we're going to build a plane, bring us your parts. They spec out what they want very clearly. General Electric and Rolls-Royce, provide jet engines and things like that to their specs. That's the way it works. We just kind of shut off that side of our business mind when it comes to healthcare, and we just need to turn that back on.
Well, it's interesting. I mean, there's so much packed in here. So one of the things that you mentioned is that this healthcare industry has failed to evolve over time, whereas our world is evolving. And I can see that knowing the health insurance landscape a little bit. There's few carriers and fewer health insurance provider carriers. We've seen costs go up. I mean, even this past year, 23% wasn't uncommon for most people, seeing their overall costs rising. And that's just 1 year. And then you look at things as a whole, it feels like, well, the options are, You look at an HMO plan, a PPO, possibly doing an HSA with the major carriers, and that seems like the only option. You're talking about something that feels completely outside of that range of what most people are presented as the full spectrum of options. So how do we not only make that shift, but who is this accessible to, and where do they find this other way of being? I think you were talking about direct primary care.
Yeah. I mean, unfortunately, everybody's been put in a box, which you described, and you're basically in this box with the lights out, and you can't see anything. Everything is obfuscated. And so we get them out of that box. And what we did, the nonprofit that I started, we drew some insights from what happened in the built environment with LEED, where they accredited professionals like architects. So we accredit professionals. You could call them the architects of health plans, are people called benefits consultants or benefit brokers or benefit advisors. And what has happened in financial services, where you all may remember stockbrokers, largely went the way of the dodo bird. The smart ones reinvented themselves as financial and wealth advisors, better disclosure, better alignment. We're at the front end of that shift. So the great benefit advisors, we've had 1,500 apply to our program, 214 have made it through, and they pledge to honor what we call plan sponsor bill of rights. So plan sponsor is kind of an umbrella term for an employer or union or whoever's paying the bill. An advisor, benefit advisor code of conduct, and an advisor disclosure form. Now, if you're outside the healthcare industry and you look at these things, you're like, well, gee, that looks like motherhood and apple pie. What's the news here? Well, unfortunately, it's a 180 from the norm in the industry. Typically, the brokers are paid more the worse job they do, because they'll get paid a commission, especially for small businesses. So the more your rates go up, yay, they got a raise. And it's obviously boo for the business. So you have to, people always ask, what's the first thing you got to do? You got to get the right aligned advisor. That's why it's the tip of the spear of our movement. And you can go to healthrosetta.org/map. We put them in the map, or just email us. We'll help match make you with somebody who's aligned. And who it's applicable to? Everybody. We're a tiny organization. We've got 7 people on our health plan. We certainly are more constrained than a larger employer, but essentially we still can have the same basic blueprint. What's our health plan? We build on the foundation of primary care. So everybody gets direct primary care. If it's not available in your market, like where I live, there's virtual primary care. So that's the foundation. Then we essentially, to use industry terms, we essentially self-insure for claims $1,000 to $6,500. We're a tiny self-funded bootstrapped organizations. That's what we can afford. And then above that, we have a very high deductible health plan, which kind of operates in the equivalent of a stop loss for a larger employer reinsurance. And this year is the first year we've ever had a claim actually go above our self-insurance, because we have an individual who got MS. So, we're not going to get financially ruined as a business because we have that insurance. And oh, by the way, we've got a, drug coverage as well. And so we have, an ethical organization that doesn't play all the games. And in all cases, we get access to our data. What business that's proud of what they're doing suppresses the data about their service? That's the norm in healthcare. And there's all kinds of smoke and mirrors that they'll use. But it's like, again, what other business would hide the data if they were really doing a great job? So if you can't get the data, you're blind, you're in that box with the lights out.
Dave, I want to hit on a point for our listeners and people watching that I don't think people understand enough. And you brought this up, is that, for any typical business, they have an amount that they can actually use for employee benefits, which include wages.
Yeah. And
people have this mindset that oh yeah, but I don't make as much, but I do have really good health insurance. In their minds, it's really good health insurance. However, that health insurance keeps taking bigger parts of the pie, which has suppressed wage growth, as you mentioned, over the years. They they don't realize how much of that benefit is only a benefit to them if they use it.
Yes.
So they're really not getting an additional compensation if they're not using it. And what's ironic on all this is if you do consider yourself to keep yourself healthy, you're actually giving up even more of your compensation to somebody else.
Yeah, I was just going to say it penalizes the person who owns their own health as opposed to the one who goes to the doctor all the time.
Yeah, and so that wasn't a question or anything, but I just wanted to reemphasize that point for our listeners, because we're always trying to find it, get people to think differently, like you mentioned. That's we have this right here on a think differently. Because we are programmed by big pharma, by industry leaders in every category of financial services to think a certain way. And I loved how you started out the podcast by saying, it's so complicated, you really need us.
Yeah.
So let me ask you a couple more questions. First of all, I have a business owner who is approaching bigger businesses with more employees to say, hey, we can actually put a physical therapist in your particular manufacturing plant at an excellent cost, and then somehow they're then going to a high deductible, like in self-insuring, like you're talking about. And even though they're paying that additional service for the physical therapist, they're finding that the employees aren't using as much of the healthcare and the self-insurance because they have access to this physical therapist. So do you see any bigger organization actually going to hiring physicians and nurses to have full-time staff on site, or at least available at their own clinic? They only work for them. Would that make sense in this situation?
Yeah, absolutely. There's a whole category of businesses that are in that business of providing that on behalf of employers. There's some employers who literally they're employees of the organization, but most commonly they contract with an organization like a Vera Whole Health or a Crossover, one of these that provides it on site, and depends on the model. Like in the case of Vera, since I'm near Seattle, I'll use Seattle as an example. Vera provides the health, the primary care for like the city of Kirkland, which is a suburb of Seattle, city of Everett, the Gates Foundation, Expedia, Seattle Children's Hospital employees, Virginia Mason Hospital employees, Trident Seafoods, and they have clinics, either in their business or right by it. And the nice thing is, in a metropolitan area, people live all over. Any one of those employees at any one of those organizations can go to any of the clinics of the others. So if they're, they live in Kirkland, but they work down in Seattle, the spouse or whatever can go to that clinic in Kirkland, and they really do a good job. In fact, speaking of Kirkland and COVID, that was the first locale in the state, in the US to have a COVID case. I don't know if you remember that.
No.
And yeah, that was the first place. It was the nursing home there. And
That's right.
it was actually, one of the reasons Seattle didn't blow up in the same way that other cities did was actually the city of Kirkland has Vera. The hospital there has something called 98.6, which is kind of a virtual text-based primary care. Like that stuff was ready to go. And so they were on it right away. And so you see the employees in the city of Kirkland, rather than that money that the equivalent of the HSA in the public sector is called the HRA VIBA. They have millions of dollars sitting in the employee accounts that they can take through their entire lifetime that would have otherwise disappeared into the ether. Because what they did was they went to a high deductible plan. Doing that alone actually worsens the situation, and that's been the solution that a lot of the industries offered. They didn't do that alone. They then funded the HRA VIBA to that, delta of their deductible. And so then it put it in their hands, and guess what? They become wiser consumers. And so they have those accounts, and that's essentially adding to their, their retirement fund, because even with Medicare, a typical couple will incur over $200,000 of medical expenses in retirement. So it's really nice to have that there. So those are the types of things that, yeah, absolutely. And you mentioned PT. Do you know that 2% of the entire US economy is tied up in non-evidence-based, non-value add musculoskeletal procedures, which is essentially one of the main things that PT offers. And so it's typically—
What was the percentage?
2% of the entire US economy.
Wow.
Because generally, I mean, the rough math is, healthcare is about 20% of GDP. Musculoskeletal is about 20% of spending. So it'd be about 4%. And then half of that, 2%, is non-evidence-based. To their credit, Virginia Mason did a study with Starbucks employees, and it's been replicated elsewhere, where they found that 90% of the spinal procedures they were doing didn't help at all. PT would have been more effective. Again, in our perverse incentive, that actually hurt their bottom line to do the right thing by not doing unnecessary spinal procedures, but that's extremely common. So you have insane levels of opioid prescriptions and insane level of spinal procedures that neither have evidence behind them versus having PT. Maybe the PT comes by once a week. We've seen that with the chicken processor. They're a bigger organization, like a large multinational tire manufacturer. They've got full-time PT on there. The Rosen Hotels, was in the TED Talk that you listened to. They got a full-time PT that's not only in clinic, but goes out into the workplace and teaches people about proper back health and stretching and things like that. And you can get incredible savings. And I'm one of those people. 80% of adults will have an acute back episode. It's awful. Feels like there's a knife in your back. If you're told the pill is going to solve it, like, okay, give me it. Told the surgery is going to solve it. Okay, cut me. But if you actually have the right model, like, no, Dave, you may think you don't want to move because when you moved, it triggered. Like, no, you actually need to do these movements. You can get immediate relief, not 100% relief, but you can start on that journey much better than all these other crazy things that we're doing.
So this, oh my goodness, this is so fascinating. And honestly, you're talking about back pain. I mean, I personally have had back pain. I come from a family of chiropractics, and I've had friends who've had the back surgery from neurologists. So when you're talking about an opioid crisis, I mean, this is something that, I have not been aware of that type of abuse of opioids in terms of back pain, but at the same time, I can understand and viscerally feel in my body why somebody would choose that. And yet at the same time, how does things like supplementation and true healthcare prevention and chiropractics and things like that, how does that play into this type of a health model?
Yeah. The thing I'll say there is I'm 100% for those. I live for those. They are awesome and great. That's not where you're going to get big near-term cost savings on like diet, nutrition stuff. It pays off over the long term. So if you're committed long-term, you'll get that payoff. So you look at a Rosen, they do have an on-site clinic that has PT, dietitian, health coach, chiropractor, pharmacist. A fully actualized primary care has all those things. Behavioral health, there's a lot of, particularly now during COVID, a lot of mental health issues. And sometimes mental health issues manifest themselves as physical pain. And so if you have the right kind of triage process, you're like, oh, it's actually, because people, a lot of the reason why people go to the doctor is pain, understandably so. And with the right triage, like, that's actually a mental health issue. Let's walk you down the hall to our behavioral health specialist and address that. And so, again, at the same time, I mentioned the dietitian at Rosen, they subsidize healthy food in their workplace. I mean, those are all awesome things. Don't get me wrong. But if you're talking about near-term cost savings, there's a lot easier money to find just in getting rid of price gouging and profiteering. And then again, if you really value your employees and you value a high performance workforce, the proper primary care that includes things like mental health services and PT makes a massive difference.
So this sounds to me almost like a utopia of an amazing world where not only is the employer saving costs,
Yep.
they're getting better health care. From what I'm understanding, you're saying is the employer is paying less cost, but the cost that they are paying, instead of just paying health insurance, they're paying something for what might be a different word to use as our typical way of thinking about health insurance. And then they're funding that the self-insurance up until the stopgap. And so overall, they're paying less, getting better quality of care. Am I understanding correctly? And if so, how in the world do we take the first step to get into that utopia where you're talking about having those healthcare providers and clinics based just for your organization?
Yeah, I mean, it's funny you mentioned Utopia, because I kind of early in this journey, I had come to this conclusion where as I really dug in, I was like, wow, on the one hand, you look at the status quo where it's a dystopian reality. We've got the opioid crisis, we've got 20 years of wage stagnation and decline, we've got miserable outcomes overall. And by the way, doctors and nurses have record levels of burnout and even suicide. Like, this is dystopia.
Yes. Yes.
And then over here, like, it's utopia by comparison. Like, this is easy, right? That's just a marketing problem. Of course, a challenging marketing problem. Who wouldn't want that? And so, yeah, it goes back to get the right advisor, guide you through. And part of the process is diagnostic, like how fast do you want to move? Where is your workforce located? It's easier if there's a concentration of people in one place to do an on-site clinic. You got enough people. Others are distributed. So you have different tools that say, in that, going back to that local acrostic, you may like, okay, for sure, do they owe? Like, get things right there. Nobody's going to notice it, but going to make a big difference. Watch claims, stuff like that. It's, again, kind of boring stuff, but if you have the right person doing it, huge savings there. And then you can just knock off. I mean, again, I'm a big believer in primary care. We walk the talk with our own health plan. And in a fully realized primary care setting, like exists in some of these employers, like exists in places like Denmark, 90% of the issues that people come into the healthcare system for can be fully addressed in primary care. That's not what most people experience in the US today. So whether you're a small employer like we are, where we can access direct primary care, or you're a larger employer that, typically if you have 500 to 1,000 employees, it can pencil out having in one location an on-site or near-site clinic. So again, it depends on your particular situation. Either way, you got to get great primary care, and it's one of those things where it's a shockingly positive benefit. In fact, there's some companies that can't afford the full, like Blue Cross plan, like restaurateurs and some like that. They're actually paying for primary care. They'll say, okay, we'll cover this. That's all we can afford, and people still love it. And most of the time, that's all they need.
So let's say, Dave, let's say President-elect Biden calls you and says he's already been on record saying that, of course, politicians can be on record for saying anything, but he's already been on record saying that he's not really for Medicare for all. So it would seem like this would be the next natural progression. And he says, I want you to be part of the cabinet and take care of this problem. How would you take care of this problem?
Yeah, I mean, that's a long discussion, but I would say a couple things. One that's a wonky thing, which is you may have heard of ERISA. ERISA was a legislation that passed during the Ford administration. It oversees retirement benefits and health benefits. And most of us are quite familiar with it on the retirement benefits. And, we have investment committees and stuff like that to decide 401k plans. And there's the, fiduciary duty on behalf of your employees is one of the highest duties under law. Even though health benefits sit under it, it really hasn't been applied in the same way it's been applied on retirement benefits. So I'd say, go out yourself or your Secretary of Labor, say, we believe that ERISA fiduciary duty really applies. And essentially that's self-regulated reasonably well in the retirement benefit side, because if you go off the rails, there's class action attorneys who are going to put together classes. There's been cases that have gone to the Supreme Court on the retirement benefits stuff for, by comparison, penny ante stuff compared to the healthcare. So that'd be kind of the wonky thing. Number two, I would say you've got between 4 and 5 million federal employees. You're an employer. You know, there's 4 roles that government plays, and people always forget that role. You know, they're a regulator, they're a payer, they do public health, and the one they forget is they are an employer, and they're getting just as bad a deal as everybody else. And so you've seen that in other areas. I mean, you know, government procures advanced battery technology that allows, you know, SEAL teams to go out there with, you know, long battery life, sometimes solar, and, you know, things like that. We need to do it here. And I'd say that across the political spectrum, across to all the governors, like whatever your political philosophy is, I don't care whether you're the most radical or most progressive, put up or shut up. Apply it with your employees in your state employee health plan or your federal employee plan, and you can make the market. You look in Montana, Marilyn Bartlett, she took over the state employee health plan for Montana. They were on track to have a big deficit, particularly for the size of state Montana was. It was tracking towards a $9 million deficit. In a couple of years, it became a $110 million surplus. And it not only positioned them much better for COVID to have these reserves that most states don't have, but it was much better for the employees. They had, you know, she tackled primary care, she tackled opioids, she tackled price gouging. And, you know, for that, she was named one of the 50 world's greatest leaders last year in Fortune magazine, you know, along with people like Bill Gates. And, you know, she's just a tenacious grandma. You know, literally her personal email, which we trade messages, tenacious grandma, you know, at blah, blah, blah.net. I mean, and she is a pistol, but it's totally solvable. So that's what I'd say is like, hey, you don't have to do something new, just do what others are doing. And then you prove it there, then you don't have to have some, you know, bogus, you know, or speculative academic study on what this will cost or won't cost, whatever the policy might be. And I'm always very, you know, we're a fiercely nonpartisan group. I say, you know, the cavalry's not coming from DC to fix healthcare for you employee or employers. We've had both parties in full control. Who thinks it's fixed, right? But if you actually, as a political leader, want to fix it, you know, like state of New Jersey, again, interesting situation. Back when Christie was governor, you know, otherwise a democratically controlled state, they had a big deficit coming. So Christie was like, cut services, cut staff. The Democrats were like, raise taxes. There was a union-backed think tank called America's Agenda said, no, there's a third way. Let's tackle healthcare costs. Just in drug spending alone, in the first 3 years, they've saved $1.6 billion with a B. They also put in primary care. So, you know, there's a lot of power that gets forgotten that the governments have with the power of the purchase. I don't think you need any legislation for, you know, the basically the personnel department, you know, procurement department of the government to do it right. And so we have the blueprints, we have examples all over the country. Some are quite large, some are micro like ours, and everything in between. We haven't seen a setting it doesn't work. Rural, urban, small, large, public, private. So get a backbone, make it happen.
That is fascinating. And again, I think we could see any change that we could potentially imagine from the higher up or from government authority. But at the same time, what I'm hearing you say is take that ownership personally of your own responsibility, cut the cost, and figure out how to improve the value. And it sounds like you guys are doing a fabulous job of helping people do this. So how does somebody get in touch with you, and what are you able to provide to them at Health Rosetta?
Yeah, so, you know, you can just go to healthrosetta.org, and we can, you know, we have programs for employers, we have programs for advisors. You can download my books for free there, you know, in a PDF version. You can go buy it if you want. That's great too. Like when you, my latest book is just at Health Rosetta medicare.org/relocalizing, for relocalizing health is the name of the book. And it'll send you a series of emails that will kind of break it down week by week, so you can get educated on that. One of the things we do that I touched on earlier of the healthrosetta.org/map is there's advisors in your area, but you can just reach out to us, and we'll do our, you give us some insight in terms of where you are, type of business, what your appetite is, and then we'll do some matchmaking if you'd like. So we're happy to do that. Your options, I will say, your options are much greater when you have over 50 employees. It's a lot easier there. On the other hand, when you're under 50, you're not subject to regulations. So you can do some very creative stuff like what we've done. So it can be done. It's definitely easier if you're over 50 employees. So yeah, those would be some of the things. And, you can follow me on LinkedIn or Twitter. I'm at Chase Dave on just about everything. And so we put out a lot of content. We have programs, we have summits, we get together. They're virtual right now. We've got regular webinars. And so we can kind of meet you wherever you're at in that journey. Most people want to get educated a little bit, but some are like, oh my gosh, we had this with a manufacturer in rural part of Washington, basically where Kurt Cobain grew up and kind of grunge music started, kind of an economically depressed area. They had a 50% premium increase. And like this is going to kill us and our employees. We, rip off the Band-Aid. And this is just a 60-person company. Rather than a 55% rate increase, that next year, their healthcare spending went down $600,000. That's a lot of money for a 60-person company. Mm-hmm. And so, again, we'll meet you where you're at, point you towards the right resources. And again, it just takes will. And if you have the will, we will find the way.
Well, that's excellent. And Bruce, I'll wrap us up. Do you have anything you want to share before we do that?
Well, I need another couple of hours with Dave.
I know, right?
Yeah, it's wonderful. Thank Dave. Seriously, thank you for this, because this is the kind of value that we want to bring to our business listeners. And like I said, it's kind of kismet, because I have this appointment with this group here in St. Louis to talk about this, and getting creative is what entrepreneurs do to solve problems. Unfortunately, a lot of entrepreneurs are so busy in working on the airplane while it's flying that they often do not take the time to do this until, like you said, you get the 55% rate increase, and then they think it's serious.
Well, and there's actually a great advisor in St. Louis named Adam Berkowitz, and he's been working with, I think it's Bio St. Louis, which is kind of they've kind of broadened just beyond bio, but they're really focused in on working with employers. So there's actually some really good stuff going on in St. Louis, just as an aside.
Great.
That's fascinating. And this whole conversation has just been really eye-opening to me. I thought we were jumping into a small conversation, which ended up being a much grander scale than I had anticipated. And at the same time, it's just fascinating to have your lid taken off in any capacity when you think about the limits and the constraints that we have around us and our mental constructs. And you just kind of completely blew that box apart and said, there is so much better way. So even though we have talked about this grand topic today, health insurance is just one small part of a bigger picture. And we've alluded to this a little bit before. We want to not only keep more of the money that you make, then protect that money and then turn that into cash flowing assets. Ultimately, you want to be on a trajectory and a journey to building time and money freedom, where you have an income stream from assets that exceeds not only your bare bones living expenses, but anything that you could want and imagine in your life. And that is the ultimate end goal, so that you can truly make the greatest contribution. And so if you are an independent-minded wealth creator, you're thinking differently, you're willing to be challenged to think differently about your financial resources and about how to do that, we would really love to have a personal conversation with you. And you can book a call with our advisor team at themoneyadvantage.com/calendar. If you just go to The Money Advantage, you will find everything that you need there. We talk about privatized banking, we talk about alternative investments, and we talk about cash flow strategies like this one, but this is one of a cash flow strategy that is tremendously amazing. And we talk about others as well to increase the money that you keep. Now, I also want to make sure that you know that we thank you for listening. Please rate and review us on iTunes, and we'd love to hear your questions as well. You can send them over to us at hello@themoneyadvantage.com, or you can send us a voice message by going to the Money Advantage and clicking on the link at the top that says send us a voicemail, and we'd love to play your questions on air and answer them. Thank you so much for being with us, and we look forward to next time. In closing, success leaves clues. So model the successful few, not the crowd, and build a life and business you love.